Hello, I have a question from a reader who asks, what is the ideal age to have a knee replacement done? Uh, Most surgeons would restrict knee replacement to people who need it and who are older than about 50 years old. Why? Traditionally, we find that these implants that are put into the knee joint, they have a performance lifespan of about 10 to 15 years. Imagine if I put it into somebody who's 30 years old, by the time he's 40 or 45 years old, we have to consider changing a new one. So what's the problem with changing a new one at a young age? I have a car tire that is no good and I change a new tire and there it goes, it's like brand new. The difference is whenever we do surgery onto the knee and remove the bone and put in the implant, when you redo it a second time, there is more bone loss. So you're losing real estate. If a person is 70 years old, we have no problem doing the knee replacement because it will probably last them their rest of their lives. However, if you are somebody who is young and there's no other treatment available that will effectively remove the knee pain from osteoarthritis of the knee, then in such patients you have no choice but you have to consider doing a knee replacement for them. Okay. Are there advances in the type of knee implants that can give you very good results and make it last longer? Well, one of them is the use of a ceramic coating over the knee implant. Traditionally, the knee implant is made of metal, and there is a metal in the put onto the distal part of the thigh bone and a metal put onto the proximal part of the shin bone. Metal and metal, but in between we put a plastic so that the metal articulates on the plastic rather than on metal. The problem is wear particles. The plastic generates small, tiny, microscopic wear particles, and these wear particles can migrate into the nearby bone, and the body will try to remove it, but they cannot remove it properly, and they form little holes into the bone, and this is what we call osteolysis, and that is one of the leading causes of failure after 10 to 15 years of knee replacement. Now, ceramic coating over the metal makes it very smooth. That means that when you're walking, the amount of wear particles, the tiny particles of plastic that is generated becomes much lesser. So if a person is younger, a person who is more active, it is worthwhile to spend a bit more money, buy the more expensive implant which is coated with ceramic, and it'll give you a better shelf life and performance life. After knee replacement, when can the patient return to running, jumping? Now, generally we don't advise our patients to run or jump after a knee replacement surgery. Now, knee replacement surgery generally are meant for older people, but of course we have people who are 50 years old and who still want to be very active. They want to play some games such as tennis, squash, badminton. They want to go bowling. Some even want to run and jog. Now, play tennis I think is fine. However, running and jogging probably should not be pursued. The replaced knee does not behave like a normal knee. It gives you a pain-free knee, but it is not as flexible. So you may find a bit difficult to run. However, walking should not be a problem. So when can they do it after the surgery? Once the knee is no longer inflamed and the range of motion is back and the muscle of around the knee joints are back to full strength, that is the time that the patient can get back to work. When is this? It can vary from about a month to 3 months after surgery. So it is depend on the individual.